let's just talk more about that. Let's, real quick, normal pH is between 7.35 and 7.45. CO2 is between 38 and 42. These numbers are important. These two numbers are the most important. The rest of them are kind of figured. PO2 is between 75 and 100. Guys, you have to get into the, especially the ER patients, get into their chart. When you start looking at them, start looking at their laboratory results. If you don't understand a laboratory result in the ER, ask the attending. Ask the attending. Ask the attending. Ask the PA, ask the attending. Ask the person that's taking care of that patient. Okay. Normal pH is between 7.35 and 7.45. Okay? Normal pH is between 7.35 and 7.45. If it's less than 7.35, it's acidotic. If it's more than 7.45, it's alkalotic. There's two ways to become acidotic. One is if I don't breathe enough. Okay? If I don't breathe enough, I have a respiratory acidosis. If I don't breathe enough, my CO2 goes up. Okay? How can I do that? I can do that by shooting you in the head, and then you don't breathe. I can do that by putting a Walmart bag on over your head and not breathing. I can do that by putting such a metabolic load on you because of your sepsis or your lack of hemoglobin that you no longer have enough oxygen delivery to meet your metabolic demands. Okay? That would be a metabolic acidosis or a decrease in CO2. So let's just stay with this. You're not breathing well enough. Your CO2 goes up. Your pH is low. Your CO2 is going up because you're not breathing effectively. Like this would be the person. This would be the narcotics overdose. The person with a respiratory rate of 4, or the person who just can't breathe well, a CHF or a COPD or something like that. Another way to become acidotic is your bicarb is low. How could you make your bicarb low? How would you make your bicarb low? Think about it. Their answers are right here. Does anybody know what mud piles is? This is how you become a metabolic acidosis. Mud piles, write this down. Methanol, uremia, diabetic ketoacidosis, isoniazid, lactic acidosis, ethanol, and salicylates. Did you get that? Okay, good. See the film. Methanol, not ethanol. We drink ethanol. We do not drink methanol. Okay? Methanol is antifreeze, not isopropyl alcohol, not rubbing alcohol. Uremia is renal failure. D is diabetic ketoacidosis. P is paraldehyde, which is British Tylenol, I believe. Isoniazid or iron is another I. Iron poisoning, lactic acidosis, ethanol toxicity, and salicylates or aspirin toxicity. Those are the big. Now, those are just the basic. There are lots of additional findings in mud piles. Look at Tintinality. Open up Tintinality and just ask for mud piles, or Google mud piles. That works too. Other things, diarrhea. Why would diarrhea give you a metabolic acidosis? Because you poop out all your bicarb. Another way is drugs. Other drugs that make you acidotic. There's a lot of different ones. There's tons of drugs that'll make you acidotic. And renal tubular acidosis. This is an anion gap acidosis. Mud piles is for an anion gap metabolic acidosis. That's if there's a difference between your positive ions and negative ions, sodium and potassium, chloride and CO2, greater than 13 milliequivalents. Okay? RTA, and diarrhea for that matter, is a non-anion gap metabolic acidosis. We'll talk about that later. Okay. Alkalosis. Decreased CO2. How do you do that? By hyperventilating. Why do you hyperventilate? Because you're at 15,000 feet. Okay? Hyperthyroidism, like thyroid storm, and hypoxia, which again can happen if you're just in an oxygen-deprived environment or you're in an aircraft that just happened to depressurize at a certain period of time. And then metabolic alkalosis. Vomiting. You're vomiting. This would be like a 2-year-old or an 18-month-old with pyloric stenosis. would have a metabolic alkalosis, a hypochloremic metabolic alkalosis at that. Volume depletion, like you're just like, I don't know, dehydration. Diuretics and steroids will also do it. Not typically, but they can. Okay, I'm just going to put this down because it's infuriating to have it in my hand and not have it work. Okay. The kidneys or the lungs. That's what you're trying to decide when you look at an acid-base disorder.